Okay, what is public health? Sounds like a simple question. The fact of life is that very few Americans have any concept of what public health is. To a lot of people, public health means disaster response, and this is certainly true since 9/11. Here we are on the 11th anniversary of 9/11. Certainly true since then that an awful lot of people think it's just responding to a crisis, to a disaster. A lot of people think public health is health care for the poor, people who maybe can't afford it otherwise themselves. Any number of people will tell you public health is behavior nannies is one of the kinder expressions. Sometimes it gets a little nastier than that. For example, New York City deciding to limit the size of soft drinks to 16 ounces, which has been the subject both of mirth on the part of some, anger on the part of others, and congratulations to the mayor on the part of still other people. We're going to talk about that one later on as an interesting example. When I say the behavior nannies, I'll never forget. I should tell you, by the way, just it doesn't matter, but politically, I stand kind of in the middle and maybe even slightly right of many of my colleagues in public health. Public health is a field where I think it's fair to say, on average, people are pretty far left. And you don't find too many people on the right side of the spectrum, although there definitely are some. There's some very important people in public health. But I'll never forget the time I went to an American Public Health Association meeting in Florida, in Miami, and I had my badge, American Public Health Association badge. I was walking along, and there's some guy who had a different badge for a different convention, and he said to me, "Oh, you at that public health meeting?" And I said, "Yes." And he said, "Communist," and he walked right away. So that's a perspective. It's not a fair one, but that's one perspective. There are other people who think public health does nothing but restaurant inspections, looking for cockroaches. It's actually a fairly important function of local public health. There have been some very famous restaurants. How many of you had parents who went to school here as undergrads? Okay, ask them if they ever went to the Pretzel Bell. And I'll bet you anything that they did. The Pretzel Bell was the place to go on a Friday or Saturday night. In fact, it was a place you went on your 21st birthday when you were allowed to drink, and you would stand on a table in front of all your friends and all the other people amassed there and chug a beer. It was a wonderful place for all kinds of entertainment. It was shut down by the health department and eventually went out of business precisely because they had problems with cockroaches and a number of other insects that really weren't their fault as much as the structure of the building. Is Champion House still downtown? The Asian, is that closed? Okay, well that's where it was, and that replaced it and was there for many years thereafter. Now here's a common reaction. I don't have any idea what public health is. So today we're going to learn what public health is. All right, how do public health professionals think about public health? My way of thinking about it, and I think many professionals, is by its purpose, and we're going to talk about its purpose momentarily. But there are others who will talk about the professionals who are active in the field of public health. One problem I have with doing that, and we'll talk about the 5 core groups of professionals a little bit later, but one problem I have with that is I think of people who run fitness centers for profit as being in public health. I think of people who make athletic equipment as being in public health. That doesn't mean that's their principal focus, but they're contributing to public health. So I think of it as being much broader than the professions we tend to associate with public health. Some people think of it narrowly as associated with the 2 methods most closely identified with the field, epidemiology and biostatistics. Other people, even within the field of public health, again think of it as governmental health services for the poor. And then there's some people who think of public health simply as the outcome, the health of the public. Now I said I like that first one, purpose. I'm not going to read you this rather lengthy definition, but I urge you to read it. It's from C.E.A. Winslow, one of the really famous folks in American public health history. Back in 1920, and aside from an occasional stilted word here or there, this is a brilliant definition, a very comprehensive definition of what public health is. Now again, I'm going to save myself and you the time of reading through it, but I urge you to do so on your own. Let me give you a much more concise definition. Public health is the set of activities a society undertakes to monitor and improve the health of its collective membership. So just a few words there, but the critical pieces of this set of activities that the society undertakes to monitor. So one of the important functions in public health is simply observing what's going on and thereby being able to analyze what's going on and improve the health of the collective membership. So what distinguishes public health from the other fields of health science? Well, one is there's a very almost laser-like focus on disease prevention and health promotion, trying to prevent disease and injury from occurring in the first place. Second, and I put the word patient in quotes, there's no individual patient. The patient is the community. If I'm in public health, I'm thinking bigger than individuals. I'm thinking about collections of individuals, the community. The same thing about the provider. The provider is the society itself, organized however we choose to do that, not individual professionals. So think about the other health professions. And by the way, there's going to be overlap, and I'll give you an example of that in a moment. But if you think about all the other health professions listed up here, and I hope I haven't missed somebody, they almost all consist of an individual provider who is providing services to an individual patient. And more often than not, the emphasis is on dealing with an existing condition, some kind of health problem. Now, obviously, you go to the doctor for preventive services or the dentist for preventive services as well. But more often than not, all of these fields are focusing on treating existing conditions, trying to ameliorate their effects, trying to make things better. So here's an example, and this actually is a very important one for a reason that I will give you later. Think about the difference between what a dentist does and what government does when we think of dental health or dental public health. You go to the dentist to have dental caries, dental cavities, treated in individual patients. Public health fluoridates the water supply, which we then all consume, and confers protection on us so that we don't get the cavities in the first place. Now again, it's not perfect. I go to the dentist twice a year for a preventive maintenance checkup. I assume that many of you do that as well. And the dentist actually will teach me health behavior things. He'll make sure I'm flossing regularly and do other things like that. But on average, the difference is the focus on problem that exists versus trying to prevent the problem from existing at all. I said this is an important example, and the reason for that, we tend to, you think of the hierarchy of health problems. Most of you all probably don't think of dental problems being very high on that list. Actually very high for a variety of reasons. But this is a field, one of the fields where public health has been extraordinarily successful. How many people in here have had more than 5 cavities in their mouths? Got to be some of you. How many of you have had more than 5 cavities but won't admit it? All right. You look around, you didn't see many hands up there, did you? There are very few people of my generation who wouldn't have had their hands up. Why is that? Because the water supply wasn't fluoridated when I was growing up as a kid. We all got cavities. We got lots of them. You all, in general, don't. You might have 1 or 2, 3, but you're not going to have 5 or more, and that was commonplace. This is an area where public health, through a community activity that was not delivered to individual people, has been enormously successful. All right, I want you to think conceptually about the role of public health. Public health should be at the very top of the pyramid when we think of how we organize our health and health services, our public health and health services. Public health should be at the top, overviewing all of it, overseeing all of it. That means the collective health services that we'll be talking more and more about, and the individual health services. There is an important role for public health in overseeing those individual health services. You see them here. That's in concept. How do we behave in practice? Well, it kind of looks like this. So medical care is at the top of the list. That's followed by other individual health services. And public health not only gets the least money, it gets the smallest font. All right, I'm going to have somebody rewrite some of my material here, obviously. But that actually indicates, we're going to look some more at some of these figures, medicine clearly dominates our public health horizon, if you will. Why does it matter? Well, first of all, it's because public health is so very important. This comes from any number of studies. I've written down several of them. These are sort of the original ones from the Centers for Disease Control and Prevention, the Institute of Medicine, Public Health Service. There have been many others since then. Here's the question. If you could prevent avoidable premature mortality, what would you have to do to prevent it? And what would be the contribution of each of these factors? Now, remember the other day we talked about the fact that almost half of all deaths in the United States are premature preventable deaths? That's a lot. Well, this is telling us that lifestyle and behavior changes could account for a reduction of half of that. In other words, half of that preventable death and disability could be avoided by lifestyle and behavior changes. Environmental improvements could address about a fifth of the problem. Dealing with human biology and genetics, another fifth. And better and more medical care could only decrease that toll by about 10%. Okay? I'd say this is widely accepted among pretty much all health professionals. Now, this is from a study by an anesthesiologist of all folks, John Bunker and his colleagues, from 1994. There have been others like it. But he estimated that of a 30-year gain in life expectancy in the U.S. during the 20th century, remember life expectancy went from about 47 up to about 77 at the end of the century. 5 years of it were attributable to the medical care system, 25 years to health improvements in sanitation, housing, nutrition, and job safety. Now, you know, those of you who have ever bought stocks or read anything about stocks, they always tell you that past performance is not a guarantee of future performance. That doesn't mean that going forward we'd have these same kinds of ratios, but the best evidence suggests that we still have a lot of room to gain much more from public health efforts than we can, certainly through health care. So think about it this way. This is a simple Venn diagram. If this is the importance of public health and medical care to health, and this is qualitatively speaking, and note that there is an intersection of these two because there are things done in medical care that certainly qualify as public health, immunizations, health behavior counseling. Pediatricians are very good at counseling about health behavior. That's a good example. But then we say, where do we put our resources? And here's the answer. And in the last year, we spent something in the order of $2.6 trillion on health care services in the United States. If you wonder how much that is, divide it by 308 billion people, and you've got a large number. Look at all those zeros. This is a huge number. Public health? Well, again, you can't read it. It's that font problem. It's about 50 billion, roughly. Nobody has a very good figure for public health because they don't know exactly how to define it for accounting purposes. About 2% of that total has gone to public health. So something is out of whack here. We've got the importance of public health, the enormity of it. We've got the funding that goes to it, which is tiny. All right, why? Why is there this imbalance? Well, first of all, market systems and the economic interests they're all associated with cater to services for individuals. The market responds to what individuals want to spend their money on. Public health is something we refer to as a public good or an externality. Those are terms that if you haven't taken economics, you may not be familiar with. We will be coming to them. But suffice it to say that the conventional marketplace will not provide public goods and externalities, not address externalities in the marketplace. That requires government. That requires governmental intervention. So the market doesn't work with it. All right, interest group politics. There are a lot of contentious issues in public health, And one of the things that we're going to see as we go through the term is that public health is a contentious field. There really aren't very many interesting questions in public health, interesting issues that don't involve a lot of very challenging politics. And then there's this thing called the rule of rescue. I don't remember the name of the author, but somebody wrote an article many years ago where he referred to this as the rule of rescue. And he said, what do people want? What people want when it comes to healthcare is to be saved when they're in dire trouble. They've had an automobile collision. They've got cancer. They just had a heart attack. Whatever it is, they want to be saved, and they're willing to put big bucks into trying to get saved. Public health involves an abstract future benefit. Again, you all don't think of water fluoridation as a big deal, but you all don't have 5 to 10 cavities in your mouths. And let's try one more little experiment here. Let me see the hands of everybody in the room who's had smallpox. Okay, I hope we wouldn't see anybody because that disease has been wiped off the face of the earth since before you were born. How about polio? How many hands? Nope. Okay, I was lucky. I didn't have polio, although for my first 5 or 6 years I was exposed to it. I could have had it because we didn't have the vaccine at that point. How many people have had mumps? Gee, I'm the only one. How about measles? Nobody had mumps or measles? How about chicken pox? Ooh, I finally found one you've had. Guess what? If you're teaching this course 30 years from now and your kids are in the audience and you ask the same question, there won't be a hand that's going to go up. Not one. Because we now have a vaccine for chicken pox. So think about what this means. These people who are having the car crashes and all that, they are identifiable human beings. We feel terrible for them. Those of you who would have had 5 to 10 cavities, or like me, would have had measles and mumps, you don't know who you are. You don't know which ones of you would have had that and which ones of you would not have had that. What we're talking about with a lot of public health is what we call statistical lives. They're statistical in the sense that we can make some pretty good projections as to how many people are going to benefit from this, but those people are never going to know it themselves. They won't have any idea about it personally. It's just kind of out there. And again, my guess is that very few of you have ever said, "Thank you, public health, for helping me not to have mumps." Or "Thank you, public health, because my teeth look nice and shiny and I don't have stuff stuck in them by a dentist over years and years of care." You haven't said that because you don't think about it. Why? Because a lot of public health success is invisible. Public health, when it works very well, means that problems don't exist. Successful public health is the avoidance of problems, and people don't ever necessarily know that they have benefited. All right, so think about this. You've got a health promotion program. You've got an exercise program. We're trying to get all the university faculty and staff to exercise. They have a big program at the university now. Well, think about what that means. The benefits of exercising are somewhat abstract, and they're certainly deferred. The concept is if I exercise regularly for the next 20 years, I'm going to avoid a heart attack at some point during that time or 10 years later or something like that. That's an abstraction, and it's a deferred benefit. The costs are real, and they're immediate. I have to find time in my busy life to exercise. I have to go out and work on some machines and sweat and do all kinds of things that I don't want to do. But think about the balance between the benefits and costs. It takes a special kind of person to make a commitment to endure those costs in exchange for this deferred and abstract benefit. Now, think about the benefits and costs of disease promotion. I don't know about you all. I am, I'll confess, something of a chocoholic. And every year when I look at this picture, it just drives me crazy. I mean, does that look good or what? Now, think about that. The benefits that she's enjoying right now are totally tangible. You can feel them. You can taste it. You can get it smeared all over your mouth. I'm not sure that part's a benefit, but. And they are immediate. How about the costs? Well, come on, they're kind of abstract. Am I increasing my risk of a heart attack as a result of doing this a month from now, tomorrow, a year from now? If I do this, maybe once a week, there's no harm in it. Maybe twice a week, there's no harm. How about 3 times? That's probably okay. And then all of a sudden, I'm 40, 50 years old, 55 years old, and I've got these clogged arteries. It's hard to make that connection.